correct the flow of the energy, which is qi, and so that it's balance it, and then they feel overall better.
Now, one of the patients that come in, I know you told me that earlier, was the pregnant women. So
Yes.
tell us, how do you help women who are expecting or women who are pregnant?
Yes, I have quite a few patients, and before I came here, just 1 hour on my way, I came here. Okay, I got a call from my office, and she canceled her appointment. She's supposed to have an appointment today at about 2:30, and because she successfully delivered the baby.
Oh.
Okay, and she came to my office like on Monday. Okay, and this is the second pregnancy.
Okay.
Okay. And her first one, based on her experience, was very scary, she said. Okay, the first baby was like 10 days past due. Okay, and the doctor, she said, used a heavy medication to induce the labor for about 3 days, and she could not get into the labor. And finally, she said, use a very big needle to break the water, and he was able to go into labor. And now she got pretty scared, and when she came to me, it's already 3 days past due. Okay, and I told her we don't have a lot of time, but just give it a try. Okay? And then on Monday, I did one treatment. On Tuesday, I did another treatment. And today, her husband called my office, and she said last night she delivered the baby. Yeah.
Well, that was great news, and it's good to know that acupuncture played a role in that, because I'm sure there were women who are watching, they may be pregnant, that didn't realize that could help them with that. And that brings up another question. You mentioned heavy medication earlier. Does acupuncture interfere with medication?
Acupuncture is very natural. It won't interfere with any medication. Okay. You can see maybe later on we can show the needles. You don't have any medication. It's very tiny. You don't have hole to hold the medication. I just put the needles into certain points along the meridians to trigger your own body. If you have pain, to trigger release of your own body, like the endorphin. Okay, and in that way, yeah. And also, a lot of patients I found out, okay, they have headache and indigestion, diabetic, high blood pressure, okay, and they take medication. When they first come in, I said, continue to do your medication, because acupuncture is not overnight. Okay, as you take more and more treatment, you probably can gradually reduce your medication, and it did happen that way. A lot of patients was able to reduce their medication, finally stop their medication. Yeah.
Now, you mentioned stress, though. Now, I want to ask you about stress that adults have at work. And so does it work the same way, the stress that you were talking about where kids may want to eat? What about work stress? I would say, I guess, work-related stress.
Work-related stress? Everybody has stress, right? If you see you can handle your work well, okay, that's okay. But if sometimes stress, we couldn't handle my work, okay, I have headache, then I couldn't go to sleep, and I couldn't eat. Whenever I eat, I feel like the burping or like the bloating stomach, okay, that need intervention from the acupuncture. Yeah.
Okay. Now, another question is, you have patients that come and you're giving some of the symptoms. What about those with maybe glaucoma or those who are having problems seeing? Have you had any of those patients, number one? And two, what treatment do you give them?
Yes, I do have such kind of patients, and eye pressure is high, okay, and glaucoma is one of them, okay, and the vision like cloudy, okay, and blur. Okay, in that case, one is probably the stress can trigger that. Okay, another one, okay, it might be hereditary or have some other issues. Okay, so and the common points I put in probably will still around the eye to activate the nerve so people can see better, and then plus the body acupuncture accordingly, according to their symptom.
And now, again, a general question. Say someone with the high, I guess, glaucoma or the pressure in the eye, how many sessions would you say to help them to lower the pressure? How many sessions would it take?
You see, and for such kind of patient, okay, and normally doctor require them either 3 months to have the checkup or 6 months checkup, okay, and as far as this kind of patient, okay, they can feel first, they see better, okay, they see clear, okay, the picture is not doubled, okay, they can see from like 5 or 6 treatments, they can see that way, okay, but patients don't do the testing until like 3 months later, and when they do, I do have a patient within 1 month is her testing, okay, and drop the pressure. Yeah.
Now, we're heard a lot about the different symptoms people have. Now, what about athletes? I know in this area, sports is a major part of the Montgomery County Public Schools. Have you had any students or athletes to come in for treatment?
Yes.
And could you tell us a little bit about some of the symptoms?
About the injury.
Okay. Injury, okay.
Yeah. Like 2 weeks ago, okay, I got a middle school kid, okay, in her class, I think gym class, okay, and she twisted her ankle. Her mother was my patient before, and immediately she brought her daughter in, just after 1 treatment, and she's like.
And that was a middle school student, you said. Have you had any professional adults come in with injuries or anything from sports, soccer or whatever?
Yes, all kind of soccer and injured lower back and some contact spots about the head.
Yes.
Okay, and got hurt on the head, and after a few acupuncture, they all feel.
And they went
better.
back to the sport.
Yeah, they went back to sports. And more recent, we mentioned about a kid, right? Another young girl. She's 11 years old. Okay, and she got hit from her brother. They are playing each other. Okay, right down here on the head.
Yes.
About 2 months, and they ran all kind of tests, MRI, CAT scan, and nothing was wrong. But she just have that headache. Okay, and with medication, it did not help. And her mother decided to try the acupuncture for her daughter.
Yes.
And after 1 session, and she said, "It's amazing. Okay, it's good for like 3 days," and she didn't have headache, but still come back for some minor one.
Yes.
So I treated her for 4 times, and now the headache is all gone for about 2 weeks. She did not experience any headache. So she went back to her soccer field and swimming, and normal activity resumed. Yeah.
Well, from listening to you today on the show, it seems like when the younger the patient is, it seems the treatments or the sessions work a little better, a little faster. And I think, and I wanted to make sure I'm getting this correct that you said, because younger people usually don't have medication or haven't been taking medications. So could you explain that a little?
As far as the treatment, who can get faster result, it really depends on people's overall health. Okay, if you're more healthy, okay, you probably got recover quicker. Okay, and also about the commitment, how often you can make the appointment. Yes. The normal commitment I required people to make at the very beginning, 2 times a week.
2 times a week.
It has some research showing acupuncture effect can last about 72 hours. After the 72 hours, it may wear out. And then before it went out, we started another one, so it worked better. Then you make it like once or every other week. Once or every other week is more like the maintenance, the prevention. Okay.
And when you say 2 or 3 weeks, I did want to ask you, because you mentioned about the overall wellness of a person. Do you recommend, because it's East West Wellness Center, exercise? Well, tell us, what do you recommend for a patient to feel better? Is it exercise or so forth?
Yeah, exercise and diet.
Right.
Okay, and stress reduction. Stress is really how you look at it. Some people look at it as not a big deal, but some people just couldn't take it. Okay.
Well, with that, we're going to have to get you back on to talk more about this very exciting medicine of acupuncture. Thank you for being on the show. This has been Montgomery Matters. I'm Greg Wims. We'll see you next time.